Baltimore has been called the heroin capital of the world. We remember that, with thousands of people addicted to the drug, fueling a massive underground economy.
But up here, above the ground, Baltimore is also home to one of the best hospitals in the world.
Yes, it is. And so it's fitting. Some of the most pioneering research into the disease of addiction happens right here.
As we continue our special Community in Crisis, Chasing the High, ABC 2 News' Christian Schaffer sits down for an exclusive interview with the head of the Johns Hopkins Center for Substance Abuse Treatment and Research.
Dr. Eric Strain is a professor of psychiatry at the Johns Hopkins School of Medicine. He's been studying addiction for more than 25 years.
We hear on the news that things are getting worse, or that there's more people who are addicted to heroin and other opioids out there. Is that what you see as well?
I think I see it, and I think that what the national surveys suggest is that there's also more problems with heroin and other opiates going on across our country. And I think there's a few different reasons that's occurred. We're coming out of an era when physicians were prescribing more opiate pain medicines for people, and if you expose more people to those medicines, those who might have a vulnerability to becoming addicted to them do become addicted to them. Some of them now are also starting to migrate over to using heroin.
I think some people have a hard time imagining how someone who maybe had a knee surgery and got some painkillers could graduate up to something as dangerous as heroin, that we have all heard that it's dangerous, and we know that it's dangerous, and that you're not supposed to be buying it, selling it, using it, injecting it, and yet people do it.
Well, it's a great question. One of the things we know is that there's a lot of variability in how people respond to a medicine like an opiate, like a pain medicine. Some people take them and they really don't like the effects. They actually avoid them. They find them dysphoric, or they don't feel good to them. And then certainly at the other end of the spectrum, there are some people who will take an opioid and they report, even after the first dose, they'll say that it gave them an incredible sense of high or pleasurable effect. That's probably some genetic vulnerability, because there's some evidence that people who become addicted to a substance have a family history that suggests that it runs in the family. So I think one of the things to be aware of is if you have some vulnerability, say in your family, to developing addiction to a substance, alcohol, nicotine, whatever it might be, that you should be careful about the use of medicines like prescription opiates.
Strain says the medical community has concluded that over-prescribing painkillers does pose significant risks, so doctors are already being more careful. But if you or a loved one needs an opioid painkiller, Strain says you should be careful too.
The overwhelming majority of people exposed to opiates don't become addicted to opiates. But I think that what we've become sensitized to, both as a medical profession and as a culture, is that there is this risk that some people will, and we need to be conscious of that. And I think for the person who's getting an opiate or has a family member getting an opiate, they should be asking themselves, do I see signals that this person might become addicted to this medicine?
Unfortunately, thousands of people are already addicted to opiates, including heroin. The largest clinic in Baltimore, Turning Point, treats more than 2,000 patients every day, most with a daily dose of the drug methadone. Strain says the medical evidence supports this type of treatment.
There are medicines that can be helpful for the treatment of heroin addiction, things like methadone or buprenorphine or naltrexone. Are all FDA-approved medications. There are ample studies showing that they can be effective and safe and very useful.
Some people or their families have enough resources for a residential treatment program. Strain says while these programs can be helpful, addicts and their families should consider it the beginning of a solution, not the end.
Changing the place, getting out of the environment into a new environment for a period of time to sort of recalibrate perspective can be useful for some people.
So it can't help but if somebody was to think, okay, I'm going to send them away to this place, they shouldn't just expect them, okay, now we're done. We fixed it now.
Absolutely.
That might not be the best approach.
That's absolutely right. Yeah. That's just the first step in a process. And again, it's a lifelong illness. It's something that doesn't get cured overnight. And it's not something that's cured after 30 days. It's something that's an ongoing struggle.
Strain says families in crisis should know there is help that can work, but he says they also have to recognize that the person addicted to drugs must have his or her own motivation and desire to be helped.
We live in a culture where we want quick fixes to things. We want to take an antibiotic for a week and be done with it. We want, something that'll make us feel better quickly. And, this is a lifelong struggle. I think for those people who embrace that and recognize that, they really have a wonderful perspective on life, because the people I've known who have struggled with addiction and are abstaining often have a greater appreciation for the small things in life because they've seen just how bad life can be.